are now required to obtain a negative PCR test result not more than 72 hours before departure, complete additional health declaration forms on arrival, and undergo a further COVID test on arrival. The health declaration form can be accessed online at www.ghs-hdf.org. Passengers are strongly encouraged to fill out this form as it helps in complying with social distancing and other COVID-19 protocols on arrival in Ghana. And these are part of measures to curb the rise and spread of COVID-19. What we do know for a fact also is many think COVID-19 is no longer with us, and many of us have let our guards down. This morning, the Director General of the Ghana Health Service, Dr. Patrick Kumabwaje, is our guest, and he will be letting us know our COVID situation as we speak and the new protocols coming on board. Doc, good morning, welcome, and Happy New Year to you.
Good morning. Happy New Year to you and your listeners.
Thank you so much. We had hoped that with the ushering out of 2022, COVID-19 will also be a thing of the past to be relived only in our memories, but it seems that that is not the case. And so these new measures have been instituted. What are we looking at now as we speak in terms of our case study, our caseloads?
Okay, thank you very much. So let me start from our own country situation. Currently, we have about 22 active cases as of the 2nd of this month. But around about middle of December, we had an active case of 9. That still means that we still have a relatively low caseload, and I think we've had of the 22, about 6 are in Accra, 5 are in Bono East, and 2 here and there. So that's still quite good. But the challenge is that we are in the flu season. We have many countries who are showing increases in cases. We have some countries have increasing hospitalization, have increasing deaths, and so obviously we will need to also start putting our guards, getting on guard so that we don't really get surprised. So that is why we are not waiting for the cases to go out of reach before we start taking action. So that's why we come up with some of those measures.
And the disbelief by some that COVID is even existed in the first place and is still with us has been a major hindrance. But the death numbers tell us a different story. How many lives have we lost since this started? I think I lost count. My heart became disheartened after we hit 1,200. So what's our standing in cases of in our death numbers now, and how can we use that to tell people that this is real?
We have about 1,460 thereabouts, but we've not had any death for quite a while now. And incidentally, we also don't have anybody who is critically sick or who is on admission because of COVID. So so the number of deaths is quite high, and if you can see that people are having about 300 deaths a day in some countries, that tells us that we still need to be very, very careful, because it's very easy to move from a low number to a high number.
So these 22 cases which we have being active as we speak, they're being managed at home following the same protocols that we knew in the past?
Yes, they are being managed at home, and they are in isolation. They are being followed up by the facilities and the district to make sure that they stay out of and they stay healthy. And then after that, we now just we discharge them after 7 days of no any symptoms. Then they go. So that's what it is, and that's why the number keeps changing and dropping. 18, 17 goes down and goes up. So that's how we do. But we also know that many people may be testing at home, and so we may not have those figures. But the most important indicator is we're looking at the hospital to see if you are very sick, you come. Are we having any sick person with COVID in the hospital? So far, no such case, and that's what gives us some hope that things are stable. But we need to be very careful. Of course, we can move from one figure to another, especially now with a few variants coming up. across the US and other places in Europe. We need to be very careful.
Last year at this time, we were concerned about Omicron and the fact that it was very different from the Delta that had come before it. Which ones are of interest to us now as we go into this new year? And should we abide by the same principles to beat those ones as well, if there are more than one?
Yes, I think now the Omicron is the dominant variant, and we have the sub-variants of the Omicron, which is the IBB 1.5, which is spreading very fast. So far, based on our sequencing, we've not been able to identify anyone yet in Ghana of that variant. But whatever it is, we just have to be using the same mechanism. Most important one is vaccination, which gives you yourself your own protection. Avoiding wearing your mask in a risky environment, whether you can feel there's a lot of congestion, there are too many people there, you have to wear your mask. You have to improve ventilation. Workplace must be ventilated. Schools must have good ventilation. And of course, hand washing with under running water or with the sanitizer to ensure that even if you touch the virus, you are unable to transmit it to yourself or to anybody. So those measures still exist, and that's what we need to.
So the time-tested ones of hand washing and limiting crowded places are still in existence. The president had a goal to vaccinate 20 million Ghanaians by the end of the year. It appears that we've fallen far short of the target. What are our figures with regards to vaccination now?
As at 2 days ago, we have so far given out about 22.4 million doses. 12 million of them have had a single dose. 9 million are fully vaccinated. We have about 3 million people who have received a booster dose. So we are not far below the target. But based on the fact that we need herd immunity, we need to move forward further. If you look at the target for vaccinated, we have about 50% or so fully vaccinated. But then if you bring it down to the population vaccinated, then it drops about 40%. When you look at the people with one dose, based on the target, the target is the people who can be vaccinated. That goes higher. But when you bring the total population, then it becomes relatively low. What happens is that they are not vaccinating children below 15. And that accounts for about 25%, 25 to 30% of the population. So already your target population is about 70% of the population. So it's very difficult to get a herd immunity. But the higher the proportion, the better. We are working towards trying to bring the number, the age for the vaccination to about 10, so that we can rope in more people to be vaccinated to help us achieve that herd immunity. So the most important tool we have now is the vaccination, and that is what we are pushing to ensure that everybody gets vaccinated.
And yet that's where there appears to be the most hesitancy, isn't there? Because even though these numbers are encouraging and they are likely to improve by the day, the vast majority have still not attained the full vaccination status or the booster shots that have been offered. What's the plan to further this course of active vaccination? Because you're saying that it's one of the surest way we can beat this.
Yes, the approaches have been now every day, every center is open for vaccination for those who volunteer to go. We are also doing some campaigns, periodic campaigns. The last one we did was in December, where we were able to, in 5 days, have vaccinated about 1.4 million people. From the 20th to 24th, there will be another 5-day campaign, and we hope to be able to do a similar number. So those are the pulses we are using to reach more people. We are also trying to train the people who are routinely vaccinating the children and others, where we believe that parents have confidence in, and they know them, to also be part of the key active people who are doing the vaccination. And I believe that it should work. The last time we got the parliamentarians also go to the MPs to go back to their constituency to mobilize people. We got some numbers vaccinated. We still have a few districts where they have less than 25% vaccinated, at least even with one dose, and T-Volta and a bit of Greater Accra. And we are hoping that we can, in the next phase, be able to move all of them above that threshold and continue vaccinating until we have that. We have enough vaccines. We have enough vaccines in the region. We have enough vaccines at the central level for everybody. So we are hoping that for those who have had just one dose, which is about 12 million, go for your second dose.
But the fact remains that for certain people, their heels are dug into the ground and they insist that they will not take the vaccines. We saw a rollout of a certain plan to limit access to government goods and services or facilities and institutions if the persons had not been vaccinated. Are we expected to see something similar with the appearance of the restrictions being gradually phased into place after what's happening in China came to light?
Well, I think there are still rules in the country on how these things can be enforced, and based on some areas you can be able to do some enforcement, but we are not there. We believe that convincing people is better than the force, because we don't think COVID is going to disappear. It's going to be with us, and so it may come to a stage where every year people will will have to take a shot to continue protecting themselves. And so I think working with the people and getting the understanding that it's important for me to get vaccinated works. So far we've had about 22 shots given, 22 million shots plus given. So I believe the process is working. We can continue working. All we want is other stakeholders, the media, our religious leaders, traditional authority, politicians, everybody come in and also show that it's safe. And so far, if you are giving nearly 22 plus million doses out, and all the fears that people will turn from male to females and reverse, I don't think anybody has seen anything. And globally, over 7 billion doses have been dished out. So where are all this happening? So I believe that with time, some people will come to realize that really it's not different from the vaccine that you carry your child from home to the clinic to give. It's the same, except that when you are giving it to an adult, it becomes a different story.
Because they have a voice, and some people want to use it.
But it's the same parents who carry their children, their toddlers, 6 weeks old babies, and they are not afraid. They give them vaccine. But when it's their turn, then they are run away. And they were given the vaccination when they were kids.
Doc, because we are talking about the vaccines and the vaccinations, where are we with the setting up of a manufacturing plant here or closer to us with our partners in, was it Rwanda and Senegal?
Yes.
A sword was cut a while ago for a plant to be set up in our part of the world to produce vaccines. Because we are on the issue of vaccination, before we move on to other topics.
Well, I think a lot has been done. I know there's a law being passed to establish the center. There's also the discussions, sites, etc. I mean, the team that are going to work on it is working. We also have the other counterpart, FDA, playing their role. FDA is supposed to provide oversight for the 3 centers. And so a lot is going on. I believe that very soon something will happen.
Schools have started reopening. Yeah. In the light of what we are seeing now, what should parents do? What should schools do to prepare for this academic season?
Well, I think it is important that school is reopening at a period where transmission is very high. We started vaccinating the kids in SHS, that's where the age really falls through. We've been able to register about 400,000, but I believe that there are about nearly 2 million of them in the 3 classes. Even yesterday, we had a meeting with the Education Minister, and we are, as part of this campaign we're going to do, we also involve the secondary school. They will just have reopened, and so I urge parents that if your child is not vaccinated, make sure he's vaccinated before you go to school. But when they go to school, we will ensure that we offer them the vaccine.
Do you need parental consent to administer the vaccines to minors?
It will be nice, but remember that children are the state property. So these are the balances that have to be done. Until you are 18, you are state property.
Now, let's get to the real reason why these added on measures have become necessary once again. It's because of what's happening in China and concerns that they may be underreporting what is happening. In the international news segment this morning, we saw the WHO expressing concern that the actual numbers are not being told the rest of the world. It's something that was said at the start of the pandemic with concerns and allegations that China did not fully present all the facts of the case. Is it the case that we want to limit travels from China for now?
Okay, let me. I don't think our position has said that China is underreporting.
The WHO has said.
Yeah, that's what the WHO is saying.
Yeah.
We are seeing that there's an increasing number in China and other parts of the world. We know that there are increasing deaths, as among other things. Ghana has, like I said, we have a relatively low vaccination coverage, so our protection is low. People are not adhering to the protocols. Those are the threats that we have. We have a very high traffic of people from China to Ghana. And so that creates a lot of problem, especially now that they are going to start the opening up. And people are going to move out. We are going to have a large traffic, not just Chinese, but also Ghanaians who go for trade and come back. And so we feel that that creates a threat. But I mean, if you have a high case in Brazil, that doesn't pose a much threat because you don't see so much traffic from Brazil to Ghana. But with China, with our trade relationship, I think it creates a major challenge. And that is why we are looking at those things. Even in the last November, December, we have over 500 people coming into Ghana from China. And so those are the issues that we are looking at. But we'll continue monitoring the situation. We are testing, and this policy comes into effect, this additional policy comes into effect from the 6th, which is tomorrow. So that's when it starts. Those we bring in a PCR 48 hours, not 72 hours. Okay. 48 hours. 48 hours before departure. And then irrespective of your vaccination status, if you're coming from China, then you get tested. Once we study the pattern and we feel that there's no risk, definitely it will be reviewed. It can be reviewed.
So you're talking about the mandatory tests that you'll still have to take on arrival at Kotka International Airport, even if you do come into the country with a negative PCR test.
Yes. Okay, let me explain the full protocol. The full protocol before the last edition was that if you are fully vaccinated, you don't do pre-departure PCR, you don't do tests on arrival. Previously, any foreigner who was not fully vaccinated couldn't come into Ghana. But we removed that. So even if you're a foreigner, if you're non-Ghanaian, you can come in there, but you'll be tested on arrival if you are not fully vaccinated. But you also have to do a PCR before coming. Now, that's one. The only additional one we have added now is that if you are coming from China for this temporary period, if you are even fully vaccinated, you still go through the PCR and then testing on arrival. So that's the only additional one. Of course, anybody under 18 is exempted from pre-arrival or any pre-arrival PCR and arrival tests, and those on transit. If you do not intend to enter Ghana, then you are also not affected. So there are quite a number of things that we are doing across that. And we are now also introduced a Sentinel test where people will be routinely be offered, even for those who are not supposed to bring PCR tests and do tests on arrival, offered to be tested, to see as part of our testing, to see how safe even those people are coming as Sentinel, so that we can also continue to monitor and review our policy.
I've heard that you said this will be random, so people will be randomly selected.
Selected and offered, which means that it's upon consent. Yeah.
And you can turn it down and say, okay, I'm not interested in that. So that deals with the random testing, but you're also saying that the test on arrival will be at no cost.
Yes, for now.
For all citizens, non-citizens, all persons arriving in Ghana.
Yes, for now.
And that's also a change from the earlier position where a separate rate was charged for ECOWAS citizens.
Currently, Ghana Health Service the reference lab has taken over the testing. And for now, it's free. And as we will review and see if we feel that there's a need to continue or change the revision, we will have to go to Parliament for the, based on the Fees and Charges Act, to go and get approval for a charge to take place if you are going to continue.
So the other company is no longer in charge?
No, Ghana Health Service, since the second has been taken during the test at the airport.
All right. So it was the Ghana Airports Company that issued that press release that we are talking about, referring to the pre-arrival and arrival processes.
The Ghana Health Service that gives it to Port to paste on their website.
Okay. So Ghana Health Service granted Ghana Airports Company this preview of the information that we are talking about, which was titled Update on the COVID-19 Guidelines for Kotoka International Airport, KIA. Effective date is 6 January 2023 at midnight. So anyone coming into Ghana would have to follow the country on arrival in Ghana, except if the passengers are coming from China, and those coming from there will be required to present a valid negative PCR test 48 hours prior to departure from China, and passengers will also be required to undergo mandatory COVID-19 testing on arrival at the Kotoka International Airport at no cost. So further details in that report on your screen. Now, Doc, we are saying that airlines that bring passengers to Kotoka who have not fully vaccinated, or passengers originating their journey from China without a valid COVID-19 PCR test, as you've said, 48 hours prior to departure, would be surcharged $3,500.
Yeah, that's it.
Per passenger.
Per passenger. Because the airline that makes sure that that person is fully vaccinated, and that he has also filled the health declaration form, and you have also seen that if he has a PCR negative result before you bring them in. Well, we can't do that. They are the ones who are bringing. They have the responsibility to make sure that they carry people according to the rules of the state. It's
not a new thing, the surcharge to the airlines. Did they abide by the first one, the initial one, when it was imposed, and were any airlines surcharged?
Well, we will have to check from the airport company. Yes, I'm sure some were surcharged.
I'll be interested in finding out how much we were able to make for the country due to some other people's disobedience. And I mean,
it's also possible that nobody broke the rules so far.
It's possible. So it will be interesting to find out what the current state of that is. So they said the release also said passengers transiting and transferring through KIA will also be required to fully adhere to COVID-19 testing requirements at their destination countries. It means that they will not be required to test in Ghana?
No. What it means is that if you're transiting to Liberia, then we must make sure that you meet the Liberian requirement. If Liberia requires something, then it has to be done.
Okay.
But if you are not entering Ghana, if you are transiting and you want to enter Ghana for a few days, then you have to abide by the rules like someone who's entering Ghana.
Right. And passenger crew are exempted from all these. But
the crew are exempted, but IATA has their own testing protocol, which we are okay with. So the IATA has its own way of testing the staff, and that's what we respect.
Right. So we are talking about COVID-19 and the new protocols that have been announced by the Ghana Health Service. We want to invite you into the conversation. Our WhatsApp number is 05555610034. Dr. Patrick Kumar-Boaje is our guest. He's the Director General of the Ghana Health Service. CAF is at the screen, and we may be picking a few thoughts from that side pretty shortly. So we've talked about what our case count is. We've talked about what our vaccination numbers are looking like. We've talked about what the protocols should still be even as we go about our normal duties. A lot of people are not wearing the mask at all. The hand washing basins, the Veronica buckets have all vanished. And they are empty and dusty. Are we seeing a comeback of those measures again? Are we going to see an active campaign like we did in the past for these?
Yeah, I don't think we stopped the campaign. So, you see, for hand washing, is not only for COVID, for many things, for cholera, for everything. Because of the hand washing, you realize that for the past so many years we didn't have COVID, cholera outbreaks or any cases. So it has effect on typhoid, everything that has to do with any any disease that can come from your hand or through that goes through your mouth. And so those are areas that we want to encourage. The mask wearing is still very important. You have to assess your risk. If you are in a place where there's a large congestion, a lot of congestion, it is important that you decide that you wear your mask, even though it's no more compulsory. People are now being empowered to identify where their risks are. You are entering a lift, a small lift with 6 people. In a few 30 seconds, wear your mask if you have one, and make sure you have one mask so that you can protect. Because that's a very small enclosure that you can quickly pick something. You don't even know the person who left last, sneezed in and went, and you just walked in. So those are areas where wherever you can have an event in an open space, it is always better. Ventilation is important. So I think those protocols are still there. Mask wearing, social distancing is very difficult to adhere to, but then where you can do it, that's why we are now pushing more for the ventilation and open space, open events. So far, with the Afrochella and Afro Nation, etc., we still haven't seen any
significant surge.
Any surge yet. So we are hoping that it stays quiet.
But were you concerned ahead of the festive season that we could see a spike?
Yeah, we were concerned because apart from the mass gathering, this is also a flu season. This is a season, the dry air facilitates transmission of
so the Harmattan,
yes, it facilitates
spread of COVID.
And that and winter, and that's why we have those problems. So this is the season. That's why we are having surges in many countries. But one of the most important things is that if you are going to a country where the numbers are high, when you get there, be very careful with your protocol. Wear your mask, wash your hands, and protect yourself so that don't bring it back home. Even though we may be at some low risk for now, if you go out there, you might also bring it and bring it home. So it's important we do those things.
Our structure still in place. I'm talking about the ones we put in place at the peak of the outbreak in Ghana for, helping more critically ill persons to get care. Our testing facilities still up to standard.
We are very far ahead. I mean, we start with 2 labs. We have over 60 labs now. 30 of them are private, 30 public. We have an emergency operating center that continues to monitor cases all across the country. For one in Accra, one in Ho, one in Kumasi, one in Takoradi. That monitors for even a system that listens to what people are saying, not necessarily in a bad way, about COVID and other things, to ensure that we are able to tailor our messages appropriately to counter this misinformation and all this hesitancy. We have built large capacity for oxygen across the country. We have brought in a lot of oxygen plants to many hospitals. We just deployed another 50 next year, or this year we're going to deploy another 70 across the country. Our ICU beds have significantly increased. We built a lot of infectious disease centers. Some of them are still going to be commissioned this year. And we'll see how we even use them in peacetime and how we are able to quickly revert to it where there's a surge to use them for that. So about 15 of them are. So it's quite a lot has been done.
Before we go, let's talk a bit more about the vaccination and the vaccines available that people can take advantage of. There's quite a list that you gave to the Ghana Airports Company, and you've told us in earlier interviews how persons can take either or whichever one is on offer at the facility that they visit. I want you to make a final appeal or a drive or a call, if you would, to persons who have not received the vaccine to get it. I have received my vaccine. I've had 3 shots of the vaccine already, but there are some people who have not even had one, and it's because they don't trust it still, despite every information that they've been given. So what do you tell people?
Well, I just appeal to our people that the vaccine is the best tool that we have to protect yourself. you can make a mistake by not wearing mask at the right time. You may not have washed your hands, but if you have a vaccine, that you carry your own protection with you, and even if you were to get infected, you are not going to be sick, you may not die. And so it is important for those who have had just one, which now accounts about 12 million people, please go for your second dose, because your immunity will drop over time. But when you take the second dose, that's when you're able to get your immunity. Those who have had it two, we're still offering the booster to give you some protection, because the antibodies drop over time. So after a month, a year, 6 months, please try and get a boost to get it done. And then also assure people that they have been in this country, they have seen the number of people who have had a vaccine, how many have had major adverse effects. Globally, about 7 billion or more doses have been dished out. Where are all the fears that we have talked about? We have had traditional rulers take it. We have pastors take their vaccine. So please, let us all have. I've taken mine. And so I think that if it is not safe, I'll be the one to know and I won't take it. But I've taken, and you saw me take it on TV. The president took it on TV. Please, let's encourage everybody. Because if you are not protected, you are not protecting your loved ones. It may not be me because you don't know me, but you may be giving it to your mother, your father, your grandmother, and that may not go very well. So we are appealing to everybody, and that from the vaccines are available all day, every day, but from the 20th to 24th, we are going to do a massive surge of about 6,000 teams to go around the country, over the banks to where there are no-go areas, no overseas areas, to vaccinate everybody, and everybody must take advantage of that.
Thank you so much, Doc, for spending time with us this morning. Director General of the Ghana Health Service, Dr. Patrick Kuma Abuaje, speaking to us about the new COVID protocols being instituted for arriving passengers into Ghana at the Kotoka International Airport. There will be a national vaccination drive from the 20th to the 24th of January. Doc, you want to add?
Yes, I want to add that at the Aflao border, we also start some testing there.
All right, and the other borders may soon join?
Yeah, may soon join. The Western, the Ivorians have not opened their border.
Okay.
So that's not, but the Togolese have opened their border, Burkina. So we will start testing also at in case anybody wants to avoid the airport and want to pass through,
it will catch them there.
To catch them there.
Dr. Patrick Kumabuaje is the Director General of the Ghana Health Service, speaking to us about COVID-19. I've heard someone say COVID is the only disease where your welfare, your own health, depends on the person next to you. So everyone else's health is important when it comes to COVID. The fact that you are vaccinated does not mean you can't get it. If somebody else who's not vaccinated gets it, you are also equally at risk. So let's go out there, 20th to 24th January, everywhere you can think of, banks, markets, schools, churches, it will be available. All the vaccines are safe. We've been given assurances after assurances to get vaccinated. It's the only way we can beat this. And let's go dust up the Veronica buckets. Let's bring back all the tissue papers and the soap and everything that we used to do before. Let's wear a mask. Let's practice social distancing. 22 cases. We want to get it down to 0 and no more. So go out there and be safe. And you know that your health is important to us at GBC. And on the GTV Breakfast Show, we try to encourage you to do anything that will keep you healthy. In our next segment, we'll be speaking to one musician who is an icon of mine, and if you are a person, you know that he's represented our language creditably. So this one I'm showing my biases and I'm saying Chale, Aleche Gonto, Aleche Kankpe, all the things we used to love about the man called Tiny package, but a big talent. And he's sitting down with our tiny presenter who also has a big talent, Valerie. After the show, it's Breakfast Live on GTV. We'll be back.